Hello, and welcome back to Gallery Dental. I'm Dr. Harbuksh Sekhon, and I'm happy to be able to tell you that we are once again able to provide comprehensive dental care as part of Phase 1 of the Alberta relaunch plan. Over the past several weeks, I think that we have all had to accommodate change in our lives as part of this pandemic. Today, I would like to share with you the changes that we have made in our clinic to ensure that we continue to offer a high level of dental care to you and your loved ones. I'm looking forward to sharing with you some of the procedural changes and devices that we have added to our clinic to ensure your safety during these times. Why don't we start at the beginning? One of the main differences with appointments moving forward is that we've incorporated social distancing measures into all aspects of your visit. This starts with a virtual waiting room for patients as you arrive at the office, at which point we will ask you to use your phone to complete a virtual check-in. Upon registering with us, you will receive a brief digital questionnaire in regards to potential COVID-like symptoms that you may have experienced or are experiencing. Upon completion of the questionnaire, you will be advised by text that you can enter the office. Upon entry to the clinic, we have set up a touchless alcohol hand sanitizing station where we would ask you to sanitize your hands for 15 seconds. From here, please proceed to the front desk if there are no patients present in this area in order to have your temperature measured. If your temperature exceeds 38 degrees Celsius, your appointment will be rescheduled to 2 weeks later. From here, you will either proceed to the waiting room and have a seat at one of the 5 designated seats that have been socially distanced by 2 meters of separation. Alternatively, you may then be escorted immediately from the reception counter to your designated treatment room by your dental hygienist or by one of the registered dental assistants. Once in your treatment room, we will provide you with an iodine-containing antiviral rinse, which scientific research has shown to significantly reduce the risk of release of live viral particles into the operatory environment. This rinse will be done twice in succession, as proteins in your saliva can reduce the efficacy of the first rinse. From this point forward, your hygienist or myself will carry on with your scheduled treatment. So I'd like to take this opportunity to share with you some of the features that were already built into this clinic, but also newer features that we've added since the beginning of this pandemic. First and foremost amongst that is that our practice was built with enclosed operatories, meaning that we contain any organic matter generated during a dental appointment or a hygiene appointment within the room that we're working in. So we're able to close off these rooms. We have doors that achieve a significant stoppage in airflow outside of this room. Again, not a negative pressure room like a hospital because that type of feature is not indicated in a dental practice. Another feature that we've implemented is this suctioning unit that allows us to place a suction hose very close to the mouth of a patient, and that allows us to scavenge any organic matter that may be coming out of the mouth as we work. Now, another feature that we've added to every one of our operatories are these devices from Surgically Clean Air, which is a device that will filter the air within the operatory. So it filters at about 500 cubic feet per minute, and with the size of these operatories, that means that we can filter the air in this room up to 24 times per hour. So again, taking care of any potential risk for any contaminants or pathogens in the air that could have an adverse effect on you as a patient. So if you want to follow me, I'm going to show you some of the other features in the clinic. So as I had described, all of the operatories are private. You can see operatories over on my right side. So again, everything is closed off for your protection. Now, as we go out to the front, you'll again notice that the clinical area has been closed off from the reception and waiting area. And again, that was a feature that was designed so that we could create partitions to control the exchange of air within the operatory. Now, another feature that we've added is actually the really big unit of surgically clean air for air filtration. So these devices are using 6 levels of filtration in order to cleanse the air in the environment where you are spending time. We have also instituted regular sanitization of reception areas and common touch points, such as door handles and countertops, because you never know where you may find COVID-19 hiding. All humor aside, I was once told by a mentor that as dental care providers, we should strive for perfection so that we can achieve excellence. And that has never been more true than now, because it is the safety and well-being of you, my patients, that are at stake. As before with my dental care, my choice has never been to provide a minimum standard of care when it comes to your safety. Rather, it has been to exceed the minimum standard and to define it instead. I believe that you, as an existing patient or a prospective one, deserve nothing less. I look forward to welcoming you back to Gallery Dental in the near future. Until then, be safe, be well, and let's crush this curve together.